Stephanie. I'm the Assistant Dean for the Center for International Education, and I've been responsible for the International Student Services Program at Madison College um, since about 2008, actually. And so I'm really, really happy to see you here with us today, even in this unique format of doing an online orientation, getting to meet you virtually. And I sincerely look forward to when we are able to meet on campus again. Um, uh, and I guess I'd like to just start by just congratulating you on getting as far as you have already. Um, for many of you, you know, in normal times, I will say that navigating the U.S. visa processes, just getting admission to a college, all of those are really daunting, stressful, very task-oriented processes to get through by itself, and you've done it. And on top of just having done it, you've done it during this incredible time of everything being virtual, of having to practice social distancing, of having to really try to figure out if your embassy is even open, when it would open, when your flights are going to be happening, if they're going to get canceled. I just want to just acknowledge how courageous all of you have been in doing all that you have done to get here. And for us, that just speaks volumes um, to your dedication and your passion and desire in being a student. And so we are so honored that you are choosing to be a student with Madison College. And at Madison College, we also are very, very committed and dedicated. You'll have a chance to talk with all of us throughout this orientation session, and then as you go into your studies, you'll have an opportunity to meet other people around campus, instructors and advisors. And I think you'll find that all of us are very passionate and dedicated here for students to serve you. And so two of these individuals are here to give some welcoming remarks. I'd like to turn to them and invite them to share that. We have both Dr. Daniels, our college president, and Dr. Jeff Bradshaw, both have extensive experiences internationally. And I guess I'll just turn it over to them at this moment so that they can share their remarks.
Stephanie, thank you. I'm going to turn it over to Jeff first.
Okay, sounds fine.
Wait, if he unmutes himself.
Thank you for that reminder. Thanks, Dr. Daniels. And congratulations and thanks to all of you as new international students here at Madison College for 2021. I want to just begin by echoing the congratulations that Stephanie started with, and really congratulating you for several things. First of all, making the decision to get an international education. Not everybody makes that choice, and there are many hurdles in that pathway, but I think you'll find that it's a richly rewarding part of your whole life, really, and not just the courses and training that you're involved in, but the cultural skills and the self-growth of being involved in getting an education abroad are things that employers will look for and will serve you well the rest of your life. So congratulations for that decision to start that process. And secondly, congratulations for making the decision to study here at Madison College. This is truly a world-class learning educational facility. The faculty that we have here are really top-notch. The small class sizes with a focus on making sure that everybody succeeds is really an outstanding learning environment. The tuition is affordable, and it gives you the opportunity to save money. And if you choose to go on to a bachelor's degree, we have the opportunity to transfer not only the University of Wisconsin, but many other university partners. And so I think it's a very smart choice for you in terms of thinking about where to study. Two of my own children have studied here, and I really think that the education they've received at Madison College is as good as any place that they could have chosen as a place of learning. And lastly, congratulating you, as Stephanie said, for making it through this difficult year. COVID-19 has made the choice of international education and education in general much harder for everyone. But it's meant that you had to surmount particularly high obstacles in order to continue your education here. And I just want to assure you that Madison College safety is first and foremost at our college. And so we have a very rigorous safety protocol for those of you who are going to be coming to the campus in person. We have a very rigorous screening process. We maintain social distancing. We use masks. We keep distance in the classrooms where we have that space. And until the virus risks decrease, we were really limiting the number of individuals on campus in order to make sure that students and yourselves are healthy and safe in that environment. But throughout that whole process, we've also maintained really strong online services. And so I think you'll find that the courses that you're taking online, that the technology services to support you in your learning, the support services for instruction to make sure that the courses that you're getting or the instructors are teaching at top level, even if it's online, and the learning support services, whether through our office, through counseling, through the Student Achievement Center, all have really robust services that are there to support you in this new environment. So congratulations on all of those things. And I'll end my remarks with one last piece of advice, and that is, while you're here, really try and get involved, both in and outside of the classroom, and use that involvement as an opportunity to share your ideas and perspectives as an international student. Part of the whole reason that we have built the international programs that we have is that we really value international students and the contributions that you make to our campus. Your perspectives and voices are things that we want all of our students in the campus to be involved in, those kind of global conversations and peer learning. So when you're in courses and there are discussions and topics where things in your home country might be done differently, or there might be a different perspective on that topic, take that opportunity to share those perspectives in the classroom and help other people get a sense of understanding those ideas from a different perspective. And also take the opportunity to try and connect with other students. With COVID, it's a little harder to build friendships, but I really encourage you to use the clubs and organizations on campus as a way to get involved and connected to others. We've had many students really excel. We've had students become the Student Senate President or Student Senate Vice President who are international students. And so there are no limits on your participation in any of the clubs and organizations. And it's a great way to have focused ways to be involved with others. So good luck on your time here. Have a wonderful spring semester, and please stay connected with our office, and let the CIE staff know if you have any questions or you're having any difficulties along the way. Thank you, and I'll turn things over to our president, Dr. Daniels.
Jeff, thank you. There's not much I can add to what Stephanie and Jeff have already stated. They took all of my key points here. Anyway, I think it's important to know that you are in very good hands when you're coming to Madison College. The staff at the International Education are tremendous. And I will echo what Jeff has said, is to stay in close contact with them. And if there are issues that come up or concerns that you have, don't hesitate to contact that office. I also know that we are really focusing this year on inclusion. And when we talk about inclusion, we're talking about international students as well. Because you have some of the same issues coming to this country as those who are in the country, who've been in this country, who have been disenfranchised for a long period of time. I know that we are going to be very student focused. That means to ensure that you're going to get what you need so that you can progress to the next level where you want to go, or to take those skills that you have learned and take them back to your countries. I wish I had the time right now face to face with each one of you. We're going to get there. It just won't be today. And it probably won't be for another few months as well. Because one of the things I would ask you, just for my own information, is why would you select Madison College? And is it what you've heard about the college? Is it the connection we have with universities, just as UW? It's always interesting for me to understand why the college, Madison College, is your college of choice. I will tell you that I don't know of any international student who has selected the institution feels that the institution did not support them or give them what they needed. And I think that's great. Jeff talked about online, and because we're in a remote environment, some of you will be here face to face, some will be in a remote environment. What I have learned are that those students who have been in the remote environment have done very well. And I think that's also a reflection of our faculty who really take pains to engage our students in this remote environment. So I welcome you to the college. I'm interested in a few of you because you seem to have advanced degrees. So that's why I want to have that conversation about the college and how we could better serve your needs as well. So welcome, enjoy this next semester. And if at any point in time you need to contact me, don't hesitate to do so, but stay in close contact with Stephanie and her staff. Thank you.
Thank you, Dr. Daniels. I greatly appreciate you joining us here today, and Dr. Bradshaw as well. Both of them are too humble about their commitment to international education. Both have, as I indicated, both have traveled and lived internationally over in many different instances, but they're involved with community colleges for international development, which is our Dr. Daniels serves as the president board member for that organization. Jeff has served with that organization for many years. They've helped Madison College get recognized for both national and international efforts that we've spearheaded for international education. So, and you know, with the online format, Madison College is not new. This is not a new format for Madison College. We've been operating and offering online courses for many, many years, and have been kind of a leader in that as well. And so you are really in good hands here. And we are truly very fortunate to have such strong leadership with a very robust knowledge base about international education, and also dedicated and passionate to that as well. So, and we thank you for joining us. Dr. Daniels, did you want the students to actually share some of their thoughts with you at this time, or?
If they have time, and I have, about 10 minutes or so, I'd like to hear some of that.
Oh, okay, that would be great. So, if you would each, Amy, if you wanted to lead them in just, were you having a certain icebreaker, or not the icebreaker, but just a way of doing the introduction that they could share about themselves? Or should we just have them each share where they are from? And
that was going to be one of the icebreakers. I could have them, I'll do that real quick. Hi everyone, my name is Amy Koo. I'll give more of an introduction in a little bit, but if you all have either another computer available, or if you have a mobile phone available, or if you don't, just open up another window on your screen. And I'm just going to have you go to this website, and then it's going to have a map, and then you'll just basically click wherever you are from on that map. So let me just show you that real quick. Okay. All right, can everyone see the map?
Yes.
Yeah.
At the
Yeah.
top, there's a at the top there's a link that says pollev.com/AQ100. You just need to go to that website, you'll enter your name, then you'll just click wherever it is on the map that you are from.
And I see our colleague Becky has put that link in the chat for this meeting as well, if that is helpful.
So if anyone has any issues with that, you can let us know where you're from later, or you can type it in the chat as well. But we'll start to see where everyone is from.
Amy, I know
Hello.
just joined the meeting and might
Hello.
not have heard the directions.
Okay, for those of you that just joined, if you have another mobile device, or if you want to open another window to this website, I see on the screen, pollev.com/AQ100, and then you enter your name, and then you're just basically clicking on the map where you are originally from.
And I see a couple of people have done that already. For those of you who've had a chance to do that, do you wish to share your name and where you're from, and perhaps for why you how you came to choose Madison College?
I could go
Hello.
if that's okay.
Yeah.
Can you see me, Vilmas?
My name
Erden.
is
Erden, you're going first, is that right?
Can you see me?
Yes, we can. Thank you.
Finally, thank you. Hi, everybody. My name is Intu Erden. Actually, I'm not international student right now because I am still waiting my new status. But I can share, of course, why I chose the medicine college. I came as a tourist to United States, and then because of the pandemic situation, I had to stay longer than I was expected, and then I started searching. Why not? This is maybe an opportunity for me, and my biological mother was nursing teacher. And I was, following her, and she took me many times to her classes, and then I started, interested. That was when I was girl, and when I grew up, I never thought I should become nurse, but I don't know. Something is telling me I should, take this measure, and then I'm really excited. And then I start looking, searching the college and the medicine college. I felt that it's first of all is affordable because of the tuition, and the second level, I tried to more than two college, and first college answer me was medicine college. So they are very flexible and fast to answer, and everybody ready to help. So I feel very comfortable, and yeah, mostly these things, influenced a lot. This is I can tell you my experience. Of course, maybe there is a lot of other issues, and and also was easier to me in having a pupillary test for English. Instead, I'm taking IELTS and TOEFL. It's more expensive and more not easier than like a pupillary test. I can tell you. Then when I tried and I get enough point to be accepted. So I didn't, even believe that my English should, be accepted. So I was so excited, and I saw in your website that my age is not unusual because I am 50 this year, and then I said usually over to 25 years student is an unusual, but I will try. I will try my best. And I know that I will have all support for me, and even it will, this course will help my improvement in my English and new measure, and so everything will be some challenge for me.
It
This
sounds
is I
like,
have to say.
well, you're speaking beautifully, and I think you're definitely well prepared for the challenge. And we are very familiar with working with students from with a wide variety of ages, and the instructors will love to hear your experience, your life experiences, and your professional experiences, and sharing that in the classroom will be a valuable part of the learning experience for all of the students. So we welcome your input. So thank you for
Very
sharing.
much. Thank you.
David, if you are there, maybe you could go next. Are you there, David?
Good evening from here, everyone. Hello?
Hello, we can hear you. Thank you.
Yeah, good evening from here, everyone. It is my delight to join this forum and to have a first-time privilege of interacting with my would-be instructors, teachers, friends, and study colleagues. We would have joined you back for the fall, but due to this problem of COVID pandemic, we have some problem, and we find amazing help from your team, the International Student Center. They've been of great help, helping through all the while. But the COVID problem is still there. The COVID problem is still there. So we see hope.
We're having just a bit of trouble hearing you, but I think if I may share, we have David and two other colleagues are joining us from the University of Ilorin in Nigeria, and they are still in Nigeria, hoping to arrive yet this semester to participate in the biotechnology program as part of a new federally funded government initiative in Nigeria to work on and look at stem cell research. Is that correct? Did I relay that accurately there?
Correct.
Yes. Yes. So we're very excited and hopeful that they will be able to arrive in person during this semester, but they are able to join us online and begin that initiative through the online coursework. And we'll be working with them for a later arrival when the embassy in Nigeria opens up again, so we can help this, develop this partnership with the University of Ilorin in Nigeria and their stem cell efforts that are underway there. So very honored to have the three of you faculty members joining us as students, and welcome again to the life of being a student.
Thank you very much. We'd like to join you.
Thank you.
It looks like Dr. Daniels may need to.
I need to leave. But again, welcome to everybody. And hopefully at some point we will be able to see each other face to face. I look forward to that. Have a good semester. Bye.
Thank you.
Thank you.
For joining us, Dr. Daniels. And Jeff as well. Thank you. All right. Are there others that wish to share? Or Amy, how would you, do you want to wish to proceed? I know Dr.
If you have other housekeeping stuff that you need to go over first, go for it, and then
We can come back to that. Okay, that sounds fine. So we'll begin with just kind of a brief overview of our Center for International Education. So we'll just give a few moments for that presentation to come up. and then we'll circle back to some of the introductions. So here's our team. So rather than having to look at us all in little separate video windows where we all are working remotely, here's our team for the Center for International Education. We're all of us are here with you today, with the exception of Tammy, who's on the far left of the picture there. Becky, if you click one more time, do the names appear? There we go. So Tammy is not joining us today, but she is one of the leaders with the team for the Center for International Education, and she does a lot of the work with the outgoing study abroad work. So in addition to supporting the incoming international students, we also develop and coordinate ways for Madison College students to go abroad, and that is a main part of Tammy's role. And she and Jeff and others on our team have been working to make that that exchange go virtual. And so we've been spearheading some virtual exchange opportunities during this period of time where physical travel and physical study abroad is more challenging. So Tammy is another individual that you'll have an opportunity to meet through the course of your studies. She helps to coordinate a program called Cultural Connect that is designed to bring international and U.S. students together for semester-long partnership. So she is not with us here today. We also have Becky, who is here on the meeting with us and the orientation with us, and she is our general office assistant, helping to coordinate all sorts of services for you. Then we have Amy. Amy is our international admissions specialist and programs coordinator. She and Becky have actually been working together lately to do a lot of the admission processing. So you've probably had an opportunity to interact with both of them already over the course of the admissions. Amy takes a lead with the admission review and processing, and also plays a role in doing some of the visa advising, as well as coordinating programming opportunities for you during your time here. Next, we have Tina, who is a lead visa advisor. You'll have a chance to get to meet her as you have any questions about how to access or any of the benefits or opportunities associated with the student visa. She also helped with facilitating some of the programming events. Then there's me. I'm Stephanie. I'm the assistant dean for the center and help with overall coordination for the office, as well as specifically within the international student services. And then there's our dean, Dr. Jeff Bradshaw, that you already had an opportunity to hear from, who really, it was his vision for Madison College that we get involved in international education. He had been doing some study abroad work, brought study abroad to the college, and then brought the international student services and internationalization of the curriculum components to the college to make us a well-grounded leader in international education at community colleges. Moving on, we also have a number of student workers that work for our office. The three on the top are all international students like yourselves that work in our office. Typically, if we're in the office, they'd be working at our front desk to greet people as they come into our office. At this point, they are doing that, but virtually, by offering some virtual front desk hours. They answer emails, respond to phone calls, and provide general assistance. Then the two individuals on the bottom are from the United States. Robin is a Madison College student who helps with the Cultural Connect program. And Laura is actually a UW-Madison graduate student in the Global Higher Education program at UW-Madison. And she is doing an internship with our office to help with programming opportunities. So in the Center for International Education, we do many different things. As I've shared, in addition to welcoming international students to the college, we also work to send both students and faculty abroad on educational programs abroad. We help to internationalize the curriculum, so we're working with faculty to be infusing global content into all of the course areas, coordinate international partnerships and training for the college. So we do a number of things for international education on behalf of Madison College. If we look at the Center, the International Student Services specifically, if you move to the next slide, for international students specifically, we are your advocate. We're here to figure out ways to make things work differently or better for you. We're here to provide support, get you connected on campus, and get you connected with the community. Help you to maintain your visa status by providing that visa advising assistance. So, you know, we're always welcoming you to contact us if you have any questions. We might not always be we might not have the answer to all the questions, but we can be a good starting point and get you headed off in the right direction. So I think it's also important, though, to point out what our staff are not, and that is that we are not visa officers. And I know that can be confusing because we have helped to give you a document that you needed to go and get your visa, and we provide a lot of visa advising, but we are not actually officers. We do have a commitment with the U.S. government to help you uphold the visa regulations by informing you of what those regulations are, and reporting that you are maintaining your status through all the things that need to be done. But we are not actually officers. We're advisors here to support you. And so we welcome you to share as much as you can with us, because that is the best way that we can support you and help you to navigate the complex visa system. We're also not academic advisors, so we are not the best place to ask which classes you should be taking. There are different advisors at Madison College that serve specifically that role of academic advising and helping you select your courses. We work very closely with the academic advisors, and so there are many times that we might be communicating together with you with your academic advisor. And as I indicated, we might not always have the answers to all questions, but we are a really good starting point. And so never hesitate to ask us whatever you might need to know, and we will help either answer that question for you or get you to the right place to do that. If you do have a question for us right now, I think email is a very easy option. You can certainly contact us by phone as well. We do ask that you choose one method at a time and not both call and email, because likely it'll be different staff people that would then be responding to the question twice, and that would delay our ability to respond to other staff or other students' questions. So go ahead and give us an email. We're usually quite quick in getting back. It could be a day or two. So if it's more urgent than that, go ahead and give a call, but we'll do our best to get back to you right away. In this virtual environment, please know we do offer drop-in assistance through a virtual front desk. So that link is on our website. We can every day of the week, Monday through Friday, from 1 o'clock to 2 o'clock, you can just click that link and be connected with one of our front desk assistants and talk with them, ask them questions. They will help you schedule an appointment with a staff member if more assistance is needed. And so that's kind of a virtual front desk. And then we also offer appointments with staff members every day, Monday through Friday. Just call or email to schedule an appointment, and you'll have a designated meeting time with one of us. Eventually, we'll be able to come to campus again. You'll be able to visit our office. This is just a little view of our office from the outside. When you'd come in, you just sign in at a little iPad station and speak with the people at the front desk, and they would again schedule you to meet with one of us or bring one of us up to help you. There are many times that you're going to be wanting to contact us, and we're going to be kind of going through all of this as we discuss in more detail what the visa requirements are, but we think it's kind of helpful to just give you a summary. These presentations that we offer here today are going to be posted on in the check-in records, so you'll be able to access them again and look at them a little bit more detail. But contact us before any of these types of things. If you want to be applying for a social security number or for the off-campus work authorization, you definitely need to talk with us before you want to do that. If you need to make any changes to your program or your address, anything like that, we'll get that updated for you. And for a number of other reasons, if you happen to lose your passport, things like that, you can communicate with us and we'll help you figure out next steps to get that situation resolved. When we contact you, we're going to be primarily using this ISS@madisoncollege.edu account. That's our International Student Services. ISS stands for International Student Services. So we'll always be sending that. So make sure that that's not blocked for any reason, because when we do send a group message, sometimes it wants to, your emails might want to block that group message, thinking it's spam, but we're not spam, we're real people. So please make sure that you save that as one of your contacts so you get our messages. We also have a website with a wealth of information that we'll be going over with you later so you know how to use that. Okay, so we're going to connect you back with Amy at this time to continue the icebreaker activity that we wanted to get started for Dr. Daniel's benefit. So we'll join again with that, and I'll hand things over to Amy. Thank you, everyone.
Thank you.
All right.
Thank you.
Thank you.
Hi, everyone. Just because some people came in a little later, just want to go over some housekeeping again. You are welcome to keep your videos on if you'd like. We love seeing your faces, but we also understand that this will be a long session, so you don't need to, but you're welcome to. Staff will be keeping their videos on when they're talking and maybe turning the videos off while others are speaking. You are welcome to use the chat when you have any questions, or even if you just want to make a comment, or if you want to say hello to anyone else, you're welcome to just keep chatting and seeing what others are chatting about. And you can use the little hand. There's a little icon that looks like a hand. If you have a question, immediate question, or if we are asked questions and you want to answer, you can use that function. We call it the raising hand function. And if you want to speak. Okay, so let's go back now to the map. I know some of you did that, but I want to return back to the map because that's kind of where we're going to pick up from. So if everyone can go back to that, if you have it still open, that's great. If not, let's go back there. Okay. So get a cell phone if you have a mobile phone, or if you have another window open, or if you have another computer available, go to polev.com/AKUE100 and go ahead and mark yourself on here. I see that most of you already did, but if you have not, go ahead and just click wherever you can on the map. When you click on the map, you'll see that little green pin show up. And staff are welcome to do that as well if they'd like to join along. And that'll show us where you're from. Has everyone done it already? Is there anyone that is still waiting to do it? Let's see, how many people do we have here? We have a couple people probably from the same place, so. Okay. So let's see, who is this pin right and over, I don't know if you can see can you see my cursor?
Yes, we can, Amy.
Yeah. So who is this one here?
Hello. Hey, my name is Edison. I'm from Colombia.
Okay, Edison from Colombia. Thank you for that. How about this one here?
I'm Lucy and I'm from England.
All right, Lucy from England. Thank you.
Thank you.
How about this one?
That's me. I'm Paula from Spain.
Paula from Spain. All right, thank you. Nice to meet you all. How about this one here?
I'm Binge. I am from Turkey.
Who's that?
I'm Vilje.
Vilje. Okay, thank you.
Yeah, you're welcome.
All right, we have two here. So how about the one on the left?
David from Nigeria.
David from Nigeria. Okay. And then how about the one on the right?
I'm Said from Nigeria.
All right, both from Nigeria. Thank you. Did I miss?
David. We have two Davids from Nigeria.
Yeah, you're both from Nigeria. Thank you.
We have Davids and one Said, making three from Nigeria.
Right. Got three from Nigeria. Did I miss anybody else? Did we get everyone?
Yeah, me, I'm from Cameroon, and it's the closest country to Nigeria on the right.
To the right of Nigeria. Okay.
Yeah, it's Cameroon, and I'm
how
from
do you say your name?
Anais.
Anais is from Cameroon. Okay. Great. And then, are we missing anyone? Ntuya, where are you from?
Actually, I am in USA, but I am from Mozambique, Southern Africa.
All right, Mozambique.
Yeah, Mozambique.
Right. So we're kind of from we've got representation from all over, which is really great. We really love to see that. So that's really exciting for us. Okay, so keep your mobile phones or your windows open. We're going to move on to another question. Okay. So how long have you been in the US? Less than 1 month? Between 1 month to 1 year, which I know is a very long time. 1 to 3 years. Oh, I guess less than 1 month will include you're not even in the US. So if you've never even been in the US, you can click on A. If you've been here 1 to 3 years, 3 to 5 years, or more than 5 years.
Can I ask a question?
Sure.
Yeah. So I mean, I've visited the U.S. before, but like I have, returned to my country afterwards, and then go again and return. So does that count as like less than a month? Or
if you want to add all of it up together, you can do that. Yeah.
Oh, okay. Yeah. Okay.
Add all of the time.
Thank you.
Good question. All right, is that everyone? All right, so 67% of you have been here less than a month or have never been in the US, it looks like. 17%, so that's probably only one person is 1 to 3 years, and one person is 3 to 5 years. Who has been here 3 to 5 years?
Me.
Anais, you've been here
Yes.
you said since 2017, right?
Mm-hmm.
Okay, so you've been here for a few years, so you have quite a bit of experience. Has it been all in the Madison or in other areas?
So I was in Alabama, and then Mississippi, and then Wisconsin.
Okay, so you live in the South.
Yes.
So it's a very different experience than
Totally different, I can tell you. It's like it's a different world here.
Well, that will be it's almost like a whole nother place.
Mm-hmm.
Well, thank you for sharing that. Okay.
You're welcome.
So we've got a wide range of experiences here. Okay, next question. What will you be studying? What program or degree will you be studying? Okay, someone's doing video production, Spanish, French. Great. Biotechnology, yep. Yeah, we have actually a lot of biotechnology students here. We have someone in IT, web software development. All right. Okay. Thanks, everyone. So, well, actually, this is the most we've ever seen of this range of programs. Usually, we have a lot of, liberal arts transfer students or business management. So this is actually very different than what we're used to. So this is exciting. Okay, choose a word to describe how you feel about the upcoming school year. How do you feel about this school year, this semester, this school year? It can be a happy feeling, a sad feeling, a worried feeling, any kind of feeling. We are just interested to know. Excited? That's good. It's great to hear.
Everyone's feeling excited, I hope.
Did everyone really put excited? Or did we only have one person who responded?
Seems like only maybe one response.
Okay. How are folks feeling?
A couple more words. Anyone else feeling something?
I try to answer, to make the answer, but I don't know what happens. I say excited, too excited.
Okay.
But
Yeah. So,
Excuse
I don't know
me,
what
Amy.
happened.
yep.
I still can't get in this map, so that's why I'm not answering.
Okay.
I'm trying this time, but I don't want to interrupt your meeting, but I am excited as well.
Thank you. You could also type in the chat too. If you are unable to get into this, you can type your answer in the chat just so that we could see what your thought is. Yeah.
That's fine.
Okay. Thanks, everyone. Well, we'll move on to the next one. All right. How are you feeling about the online learning this semester? You just need to click on one of the faces. Or if you don't feel like any of those, you can type in your how you feel in the chat. A couple of sad, little bit of sad face, some neutral face, a couple of happy faces, mixed emotions, I say. I understand that. A couple of sadder faces, feeling more, you would maybe would be more excited about classes in person. It sounds like. Yeah, I understand. Well, for those that are maybe feeling a little sadder or more neutral, there are a lot of resources to help with that. And, if you cannot find that, let us know. We are happy to help and we are here to help. So, okay. What is one important skill every person should have in life or as a student or anything? You can decide. I'm curious. I'm a very curious person. Empathy. That's a good one. I agree. Yeah. Honesty. Yeah, definitely. Those are good ones. I think good communication. But I think empathy is definitely a big one. Speaking two languages. Yeah. Many of you probably speak more than one language. Do a lot of you speak more than one language? It's a good brain exercise to speak more than one language. All right. Kindness. Let's see. A little hard to read some of those. Teachable. These are great. Responsibility. All really good things. And all things that I would think that maybe these are all things that you all have. So that's really great to hear. Okay. I think we're almost done here. So this is just a fun one. Which famous person, it could be a person who's alive or dead, would you love to meet someday? Even if they're dead. If you could meet them, who would you like to meet? Jacob Collier. I don't think I know who that is. I'm going to Google that person. Let's see. Does anybody know who that is? Carl Sagan. Jacob Collier is a musician. I will listen to his music and see what it sounds like. Where, Paola, where is he from?
He's from the UK, I think. Yeah, he's from the UK, from London. He's very talented. That's why yeah.
Oh, thank you. Chimamanda Ngozi Adichie. I would love to meet her. She sounds brilliant. Billy Graham. I would love to meet the Dalai Lama. That would be my person. These are all really great choices. Anyone else want to add? Muhammad? These are all really great. Thank you. I loved hearing that. It's just interesting too to hear how different it would be if you were to ask students from the US what they would say. It would be very different than hearing what all of you are saying in all of your choices too. So I appreciate you sharing that. All right, we have one more. What is your guilty pleasure? Or sometimes I say not guilty because I don't like to feel guilty about enjoying the things that I like. And we often say guilty pleasure. So guilty pleasure is something that you really, really enjoy, but sometimes people feel bad about liking it. Like maybe you really love eating a lot of chocolate chip ice cream or something. Or you really love watching a particular TV show that is actually really bad, that a lot of people think is really bad. My guilty pleasure is eating chicken wings. I love eating chicken wings. I could eat them all day long. Dessert, eating dessert, that's a good one. Reality TV shows. Does anyone have a particular reality TV show they like?
I like all of them. I like Catfish, 90 Day Fiancé, The Real Housewives of Beverly Hills. Like all of them.
All of them. Oh, that's great.
That sounds fun.
All of them. They're all fun. TikToks, watching TikToks. Yeah. Yep. Sleeping late. Does that mean sleeping, like going to sleep late or waking up late? Both sound really good.
I would take either of them for sure.
Staying
all day.
Uh-huh.
Sounds great.
That sounds like a not guilty pleasure. These are all good. I hope that you get to do all these all the time while also studying and doing really well in school, right? Okay. Thank you all for doing these activities. I hope that you all learned a little bit about each other and were able to share a little bit more about yourselves. We know it's a little hard to get to know each other on a virtual format, so we hope that this was a good way to really share a little bit about each other. And then we hope that during the semester, when you're taking the new international student seminar, that you'll have more opportunities to really get to know each other a little bit more. All right, I'm gonna hand it back over to Becky.
Hey everybody, I'm gonna share my screen quick. Oh, one moment. All right, everybody. My name is Becky Ariano, and I am the Administrative Coordinator for the Center for International Education. And I get to help out with a lot of different projects and tasks in the department. But one of the main projects that I work on is the International Student Health Insurance. So if you ever have questions about your health insurance, you can always contact us and I will help you out. So there's a lot of information that I am going to cover. So I definitely recommend going back through this slideshow at your convenience. And there is a lot of great important information in here. So Madison College provides health insurance for international students, and it is mandatory. But the good news is that it's really fantastic health insurance. And so we're really happy to be able to provide this for you. So the plan that we offer to you is the GHC Select Plan. And there are 6 full service primary care clinics in and around Madison, but there is a clinic that is on campus, so that is particularly convenient for you. But if there are other clinics that are closer to you, you can opt to access those clinics as part of your care as well. So the Madison College Community Clinic is right on campus. It is across the street from our Truax building, which is our main building location. And when you go to the Madison College Clinic, there is no copay and no deductible for office visits. So when you go to see the doctor at the Madison College Clinic, you don't have to pay extra. If you do go to an office visit at one of the other clinics, there will be an additional charge. And then for other services like lab work or x-rays, it is a 10% charge after deductible. So these are the primary care providers at the Madison College Clinic. The main provider that you have all been assigned is Traynell Darby. But if you need to switch providers, there are 2 other providers at the Madison College Clinic that you could see as well. And so if you need to change your primary care doctor, there's information here on how you can change to see a different doctor. But remember that the Madison College Clinic is the one that gives you free office visits. So that is beneficial to keep your care at the Madison College Clinic. That is special just for you. So there is also an urgent care clinic. So if you need to be seen quickly, or if you need to be seen sort of outside of normal business hours, there are extended hours at the urgent care, which is downtown in Madison. And so you can see that there are some weekend hours and that there are hours later in the day. I would suggest if you need to be seen and it is during the business day, that you make a call to your regular doctor first to see if they can see you today, because there is a little bit more to pay if you go to the urgent care. But if if it's later in the evening or on the weekend and you have a little bit more of an urgent need and can't wait until the next day, then you can be seen at the urgent care downtown. So this is for sort of non-life-threatening conditions that you would like to have treated on the same day that you would go to urgent care. And the charge is 10% after your deductible. So whatever the charge is, you pay 10% of that charge. There's also emergency care that you can access through your health insurance. There is the University Hospital and also Unity Point Health Meritor Hospital. And this is for emergency situations. They're open 24 hours a day, 7 days a week. And this is for more serious things like if you break a bone, if you have a serious cut that needs stitches, if you have issues with your eyes or face, you can go to urgent care or emergency care. And this is definitely for life-threatening situations. And there's a $75 charge for accessing emergency care. So sort of some different information about going to the hospital. The hospital is treated differently in different countries. And in America, unless you have an appointment for a service that happens to take place at a hospital, we really only use hospitals for emergencies. So you don't want to go, you know, to the hospital if you have a cold or an infection, or, you know, you have, you know, something sort of minor. You do want to go to the hospital if you have a loss of consciousness, if you are in a lot of pain, if you have taken something that you think has poisoned you. Just to caution you, if you go to the hospital or to the emergency room and it's not urgent, the health insurance may not cover the charges and you may have to pay all of the charges yourself. So make sure that you're using it. You know, if you do need to go to the hospital, you definitely should go, but make sure that you're not going just because it's more convenient. There is also a phone number that you can call, the GHC Nurse Connect, which is available 24 hours a day, 7 days a week. And they can just give you advice. This is a fantastic service. And I personally have GHC for my family, and I use GHC all the time, or the GHC Nurse Connect all the time. If something seems a little strange, if I would like advice, if I need to know, you know, should I go to the hospital or should I go to urgent care or should I wait to get an appointment? Is this serious? You should definitely use this phone number. And you can also ask for a translator if you feel more comfortable speaking in a language that's not English. They can connect you with a translation service so that you are able to speak in a language that you feel most comfortable speaking in. So don't let that stop you from calling to speak to a nurse. There are also opportunities to get care online. So this again is 24/7, and you can, you know, if you think you have an infection or a cold, you can plug in your symptoms into the system and it will give you some advice or connect you with, you know, with a doctor who can help you. And you get 3 free visits, and then after that, a visit is $45. But 3 free visits is a lot of free visits for this, so that's great. GHC MyChart is a web portal or an app where you can find information, schedule appointments, message your doctor. So this is really great, you know, if you want to create an appointment but you don't want to call, or if you want to look back on test results or records, you can download this mobile app and create your account. So it's just a really easy way to access your information and connect with your doctor. So I highly recommend that you create a MyChart account for GHC. So limitations and exclusions, there are certain things that health insurance doesn't cover in the US, and this may be different than in your home country, so you want to make sure that you pay attention to make sure that things are covered. Your coverage is very good, and so there are a lot of things that are covered, but also there are some things that general health insurance does not cover in the US. So things that are out of network or not for a GHC provider. So there are a number of, doctors and health insurances in the US and in the Dane County area. And you can't just go to any doctor anytime. You need to go to the doctors that are within the GHC network. So services that are not medically necessary, probably not going to be covered. Services that are provided before or after the effective date. So your health insurance, if you are on our visa support, your health insurance started on January 1st. But if you arrived in December and went to the doctor in December, that's not going to be covered. If you graduate from Madison College and transition off of our visa support and then go to the doctor after that, that is also not going to be covered. Injuries resulting in criminal behavior, don't do that. That's a bad plan. Charges for missed appointments. If you schedule appointments and then don't go to them, chances are the insurance will not cover a portion of that. Over-the-counter supplies, travel immunization, transport services, except for medically necessary ambulances, dental care. And I will send you the policy documents. Normally we would hand out paper packets, but we don't have paper packets, so I will send you a PDF with all of the information. So some things that aren't normally covered with health insurance, but Madison College offices services. Madison College does have a dental clinic where you can get your teeth seen. We also have an optical dispensary where you can buy glasses. And then we also have a massage therapy program clinic. Not all of these services are open right now, or they may be limited. And so you need to double check to make sure what services are being offered at this time. You also have pharmacy care. So if you need to get prescription drugs, you can access the pharmacy. There's a wide network of pharmacies. And so you have a lot of options if you need to get medication. So your insurance card, I signed you all up for insurance when we gave you your visa. If you had a United States address that was listed on your application, then your insurance card should be going to your address. If not, then I put in the Madison College address, which means that we will get your insurance cards and we will do our best to get your insurance cards to you. The good news is that you don't really need your insurance card to access service. It is easier, it is convenient, but if you call to make an appointment, you can give them your name and date of birth, and they will be able to look up your information and access your insurance information. So it is helpful to have the information that is on your insurance card, but it's not necessary. You don't need to wait. So you can transition your care if you have other doctors and other medical records. Make sure to let your Madison College GHC doctor know about the care that you have, and feel free to share with them the notes about your previous health care so that they can do a better job caring for you. So the cost of insurance in the United States is pretty high. So this is a pretty reasonable cost of insurance in the United States, and you have very good coverage. So for students, the cost of your insurance is $189.25 per month. We charge you 3 times throughout the year, and we charge you for an entire semester at a time, and that includes the fall, the spring, and the summer semester. And frequently the semesters are different, a different number of months. And so it may look like your insurance charges are fluctuating a lot, but they're not. It's just you're being charged for a different amount, you know, a different number of months. There will be a rate change that will happen at the end of the spring semester, and your health insurance charges may go up slightly, but it's usually just a couple of dollars a month, and so you may see some very small fluctuations, but it's not going to be significant changes. So the spring 2021 fees that you will see on your account, on your student account, is $946.25. You can also add dependents if you are married and have a spouse who is living with you, or if you have children, you can add dependents on, and it's essentially just you pay you know, the same charges for them as well. And if you need to add dependents, you need to add them within the first 10 days of the semester, and you can do that through our required health insurance page. So just briefly to go over the benefits that we offer, and if you have any questions about any of the wording of this, you can send me an email or meet with me, and I can explain this a little bit more carefully. Some of these are like jargon words that are a little bit hard to understand, but primary and specialty care at the Madison College Community Clinic is free, so that's great. If you go to a doctor that is outside of our clinic at one of the other 5 clinics or in the Dane County area, then that is 10% of the charge you will need to pay after your deductible. Urgent care visits are 10% after your deductible. Your deductible is $100 or $200 if you have dependents in your family plan. The maximum out of pocket that you will pay in a year is $2,500. So all of these 10% charges, if you have a bunch of services you need it, you know, the most you will pay is $2,500 in a year. Emergency room visits are $75. Hospital stays are 10% after deductible, and then you have your prescription drug costs based on the type of medicine that you need. So how to pay for your health insurance? It's the same as tuition. You can pay online through your student center or pay through the payment center on campus. Payment deadlines, again, it's the same as tuition. So your spring deadline to pay for your tuition and health insurance fees is February 15th. So applying for a health insurance waiver, if you are not going to be in the United States at all during the spring semester, or if you have health insurance in the United States that is as good as or better than the health insurance that GHC provides, then you can apply for a health insurance waiver. You need to do it within the first 10 days of the start of the semester, and you need to redo it every semester that you have the waiver. So, you know, you don't just apply for it once and then never have to worry about it again. You have to continue to apply for the health insurance waiver through the continuation process. If the waiver is not submitted before the deadline, or if it is not approved, then you will stay on the GHC health insurance, and you will be obligated to pay the fees that are associated with it. If you have any questions about the waiver, you can feel free to reach out to me, and I will help you through that. So we also, GHC offers counseling service, and also Madison College offers counseling service. And there are also free and anonymous phone services that are offered through the United States. GHC offers rewards for staying healthy. They have a program called Manage Well, where you can track your healthy lifestyle and get points and earn rewards. There is a free app and it's online, and you can go to this website and sign up for that, and it's fun, and there are points and prizes. Does anyone have any questions about the health insurance plan?
And you can type them in the chat if you need to as well.
Yeah, feel free to type those into the chat. If you don't have questions now, it's possible you may have questions at another time. I'm sorry, you all an echo, or is it just?
Yeah, there's an echo.
There's an echo. Okay. Is everyone else on mute? That might help. Maybe it seems like it's gone away. So at any rate, feel free to contact us if you do have questions as you go along, or if other questions arise before we move to the next section. I can just give a little personal shout out to the effectiveness of our health insurance policy. I had a bit of an accident this weekend and I broke my ankle and I went to the GHC Capital Clinic Urgent Care, and they treated me really well and sent me over to the emergency room, and I'll be headed back there later today actually for a bit of a repair. So at any rate, if for any of you that have doubts about the health insurance or concerns about it, let me just assure you this is a policy that is very commonly used across Madison by both faculty and staff here at Madison College as well as at UW-Madison. Very well-known institution. We're really proud to be able to offer that insurance care to you as well. And I will probably be leaving the orientation here shortly to go tend to that business of mine. So, but it was a real pleasure to get a chance to talk with you this morning. So,
Paula, it looks like you might have a question.
Yeah, so, you know, with this whole thing of the coronavirus, if any of us get sick with it and we sadly have to be hospitalized, would the insurance cover that? Or like it depends on how long, how would that work?
Yes, you will be covered by the insurance if you are sick, no matter how long. And your max out-of-pocket cost is $2,500. So even if you need to go to the emergency room, or you need to go to the hospital and stay for as long as you need to stay for, and get whatever procedures you need to help you get better, all of that is going to be covered in your health insurance. And no matter what procedures you need, the most you will pay out of pocket is $2,500, which is a lot of money. But as far as health insurance, healthcare in the United States, that's a very good price for the healthcare that we have. So my suggestion to you is that if you think that you have been exposed to COVID, or if you have any symptoms, please call your doctor, call the clinic, call the nurse on call, and do what they tell you to do. There are certain units, certain clinics that are set up to care for patients that have COVID symptoms, or, you know, people who have tested positive for that. And we want to make sure that people aren't walking into clinics where they could spread the virus. We want to make sure that, you know, the doctors are prepared to receive you, that you have advice about the best course of action and the safest thing for you to do, and the safest thing for the staff and other patients to do. So definitely call before just showing up in a clinic or doctor setting, unless it's an emergency. You know, like if it's very urgent and you need to go, and they will take care of you and they will help you. But if you're able to call first.
And so one more thing, you said the most amount I'd have to pay is $2,000 or something like. Is that so? In what case I would have to pay that myself and it wouldn't be covered, or it would be just covered?
So the way that health insurance works in the United States is that the clinic will send a bill, and the health insurance will cover part of the bill, and then the patient will also cover part of the bill. So there's a lot of wording like 10%. You know, like if you get x-rays, you pay 10%. So the health insurance, you know, if it is $500 to get x-rays, the health insurance will cover 90% of that, and you will cover 10% of that. So you pay $50. But if you had to get lots and lots and lots and lots of x-rays, and you had to pay $50, $50, $50, once you reach $2,500, then the insurance pays for 100% of it. So it is, you know, a weird thing. Like if you go to the emergency room, it costs $75, you know, but after you have paid out $2,500 for the year, then they don't charge you after that. Does that, and if anyone has more questions about that, like it's a weird, confusing thing, I am happy to meet with you. Also, member services. So if you call GHC member services, they can talk you through the specifics of your bill and of your services. So they can look at the health insurance coverage that you have. They can look at the bills that you have been charged. They can look at the services that you have done, and they can tell you exactly what your bills mean, and why you're being asked to pay what you're being asked to pay, and all of that. So they can do more specific information. And it looks, Edison, did you have a question?
Yeah, sorry. Yeah. Like you talking about COVID, I have a question. How about vaccine? Is covered in case of distribute here? I don't know.
I don't have information about the vaccine yet. I know that GHC is really good at keeping in contact with their members. And so if you sign up for a GHC MyChart account and you put your email address in for your contact information, they will send you emails with updates about that. So I don't, I cannot say for sure when vaccines will be available, or what exactly the cost will be. I cannot say. I know that GHC covers things like flu vaccines and other similar things, and so I'm assuming it will be on that. You know, that it will be covered and that they will help you obtain it, but I don't have any information more than that, but they will they will share that information as soon as they have it with their members.
Thanks.
Absolutely. All right. I think it is break time now. So we are going to take a quick break. So I don't know. Tina, did you have something to say about break time?
No, just a 10-minute break. We're right on schedule, so.
Awesome.
Thanks, everyone. Take care.
Thanks.
We'll be back at 10:40, right?
Yeah, so please be back at 10:40. So get up, stretch, get something to eat if you need to. See you back at 10:40.